Hypertension medication that every nurse practitioner student should know, okay? So let's simplify the hypertension medication because you are going to see this every day in the clinic in primary care setting more often, okay? So one important update is newer guidelines are moving away from choosing blood pressure medication based on like strictly on race, because treatment should be like individualized and more inclusive, right? But historically like studied, so like some patient responded better with certain medication, which is why you still may see it and taught it that way, but that guideline has been changed. Just an update, okay? So first line hypertensive medication generally includes our thiazide diuretics, our ACE inhibitors, our herbs, calcium channel blockers, not the beta blockers, okay? So now let's break them down. So number one, let's talk about like thiazide diuretics. Thiazide diuretics, they end with IDE. Example is like hydrochlorothiazide and chlorothalidone. Okay, they're good for hypertension, older adults, osteopenia, osteoporosis, because they help retain calcium. And the side effects are like hypokalemia, hyponatremia, hyperglycemia, and hyperuricemia. It can trigger gout, so no for our gout patient. And it also increases cholesterol and triglyceride, okay? And remember, patient may still need another medication because the thiazide diuretics alone may not lower the blood pressure enough. So ACE inhibitors and let's talk about ACE inhibitors and herbs. ACE inhibitors ends with pearl, herbs ends with sardine. Examples are lisinopril and losartan. They're amazing for diabetic patient, chronic kidney disease patient, because they help protect the kidney, right? So and the major side effects are like dry cough, especially with ACE inhibitors, hyperkalemia, angioedema, that's rare but very serious, okay? Never ever combine ACE inhibitors with herbs, and they are no for pregnancy. Number third, let's talk about beta blockers. They ends with lol, like metoprolol, labetalol, etinolol, okay? They're usually not the first line, no more, but they're helpful if patient also has heart failure, prior MI, arrhythmias, chronic artery disease, okay? And the side effects are bradycardia, fatigue, depression, sexual dysfunction. And the number one thing not to forget about beta blockers is beta blockers can mask hypoglycemia symptoms in diabetic patient, okay? So patient may not feel like tachycardia or tremors when their blood sugars are dropping. And always cautious with asthma, COPD, bradycardia, heart block, okay? Never ever stop them abruptly because it can also cause like rebound hypertension and tachycardia, okay? And our last one is our calcium channel blocker, which ends with pine, like amlodipine and nifedipine, okay? They are great for isolated systolic hypertension, like when their systolic blood pressure is high but their diastolic blood pressure is below 90. So common side effects are headaches, peripheral edema, bradycardia, and reflex tachycardia too, okay? And avoid with grapefruit juice, and it's contraindicated with the patient who has CHF, who has bradycardia and heart failure, okay? And they are better when they're used at night. And calcium channel blocker used to be our number one agent for our African American population, right? But no more. So you can like literally personalize antihypertensive medication as per the patient like wish or as per their symptoms, right? So yeah, that's about it, guys. Thank you. I hope this helps. Thanks. Bye bye. I'll see you in next video, which is coming pretty soon. Bye.